Good afternoon and welcome everyone. My name's Paresh Dowda and I'm one of the GPs at Next Practice Deakin. Welcome to this webinar on World Diabetes Day, which I'll hand over to Liz, who's sitting next to me, and it's our Credentialed Diabetes Educator in a moment. Before I hand over to Liz, I'd also like to just do an acknowledgement of country and acknowledge the traditional owners of the lands on which we meet, pay respects to elders past, present and emerging, and extend that respect to any Aboriginal people who may be joining us today. So without further ado, welcome, thank you for joining, and I'll hand over to Liz. Thanks, Liz.
Thanks very much for coming along today on this 101 years since the first founding of insulin. So it's 101 years since the first patient got insulin, and it's also the birthday of Banting, who found insulin. So it's a very special day. So what we're going to do today is talk about a little bit about the theme of World Diabetes Day, which is access to diabetes support and care. With the main things is speaking out and spark change. So we're working with you as individuals and persons that might be living with diabetes to improve the care and outcome for people with diabetes and for yourself. So at Next Practice, it's a great practice that I've just joined, and the purpose of this practice, which makes it very unique, is to make a positive difference to the lives of people that attend our practice and also to our community. And it fits well within the ethos of what we have for managing and supporting the person living with diabetes. As I said, today is World Diabetes Day, and the theme is access to diabetes care. So World Diabetes Day was established in 1991, and the reason for that was to highlight the impact that diabetes has on the individuals, the families, and the communities. World Diabetes Day is represented by a blue circle, which is the global symbol for diabetes awareness, and it also signifies unity. So what we want to do and what we want to do across the world is ensure everyone across the world has access to care. A little bit about moving on, we want to look about specifically what diabetes is. And you'll see in the little graph here, what it is a data taken from the National Diabetes Service Diabetes Atlas, was last updated in July this year. This is the data for the ACT, and as you can see across the various types of diabetes, 82% of our population that live with diabetes have type 2, 11% have type 1, and women, the rate of gestational diabetes is 5.3%, which is both that with type 1 and type 2 gestational is above the national average. So we have a fairly high rate of diabetes within our community, both type 1, type 2 and type 3. So the different types of diabetes that you may have heard about, and it's really important that we think about the language that we use when we're talking about describing it. We have type 1 diabetes, we have type 2 diabetes, we have diabetes other, and we have gestational diabetes. The really important thing is that diabetes can occur at any age. It is not age specific. So you can have an older person diagnosed with type 1 diabetes, and unfortunately what we're seeing is a higher rate of type 2 diabetes in young people. So it comes back to the theme here of what we have is of diabetes, World Diabetes Day, is identifying and managing it at an early point of time, preventing diabetes where we can with type 2 diabetes, and with type 1 diabetes, giving the person skills and knowledge so that they can manage it effectively and prevent the complications. As we've said, the aim of this World Diabetes Day and the theme of this World Diabetes Day is accessing care. So for the person with diabetes, it's about knowing your risks and understanding what to do and how to reduce the impact of complications. So for health professionals and for individuals leading it, it is important to understand your pathology, have regular checks-ups, and understand that if you experience any concerns, or to actually ask the questions, to be very actively involved in managing your self-care, to know what's actually going on, to be aware of of the importance of having access to the right information and care to ensure timely treatment and management is available to you. Don't put it off. Ask the question today rather than tomorrow. So how do you know if you are at risk? For people with diabetes, we know that it can actually be prevented or delayed if you know your risks. And this is often done through adopting and maintaining healthy habits. So within Australia, we have a diabetes risk assessment. And this risk assessment should be done regularly. If you're coming into your GP, that could be part of your assessment that you've done at this point around through a blood test, but you can also do it at home. So what we've got on the next slide is a link to the risk assessment that's available. So this calculator will score your risk of developing diabetes over the next 5 years. So when we've done this person here, you can see that they've scored 22, which means that they're approximately 1 person in every 3 is likely to develop diabetes over the next 5 years. However, that risk can actually be reduced significantly through changes that the individual might make. And that might be thinking about the level of activity, their sleep hygiene, managing the psychological health and well-being, thinking about your food choices, reducing your waste. All of those things is going to drop that risk profile down into the low or moderate at that point of time. So it can happen, and that's actually what a goal that we have within the practice is to actually reduce your risk down so that we are ensuring you maintain your health of your quality of life. So we've got that risk there. Please take the time then to go and maybe do your risk assessment, and that will be available after as well. So when we're looking at accessing diabetes support and care, so if you've diagnosed with diabetes, living with diabetes, or identified that you are at risk of developing diabetes or have it, it's important to know where to go and what to do, how to access support, and what's that support and care might look like. So as we're moving through, if you have identified that you're at risk or have type 2 diabetes, it is important that you know where to get your support, how to prevent the complication, and actually access timely treatment. If you are living with diabetes, it's important that you have a good team behind you so that you're getting the correct information, you're getting the best available therapies in a timely management, and that you have the tools to manage it at home. Don't delay seeking help and support, because we know that the earlier we get in and intervene, the less likely you are to get the complications that was going to affect your health and well-being. For us as healthcare professionals, it's important for us to actually have access to ongoing support, training, and resources so that we are there to support the individual in their self-management journey. So from this slide, what it is access to care and support is for all of us, both those if you're at risk, if you're living with it, and healthcare professionals as well too. So at Next Practice Deakin, we are there to support you through managing and developing your self-management care. We provide support for people with a new diagnosis of diabetes, either type 1 or type 2. We support women with a diagnosis of gestational diabetes. We have access and use technology to support diabetes self-care, and that's just the emerging field of self-management. And all of our care and management is based on current research and guidelines. So we use those guidelines to put into practice and make it real for you, for the individual living with diabetes, so that we are going to get the best outcomes at the other end in the years to come. So your support team. So it's a really unique practice that we have here. You have access to general practitioners and with specialists in chronic disease, special interests in chronic disease, the nurse practitioner in diabetes. We have a dietitian. You have access to the social worker and psychologist for your mental health and well-being. We have access to the dental therapist, you have the nursing, and we also have timely access to medical specialists. So it is a perfect diabetes care team that we offer here at Next Practice, and we are here to support you. So in summary here, this is the target that was been set by the World Health Organizations and International Diabetes Federation. So over the next 6 years, and this fits well with the ethos of the practice, for those we want to 80% of people with diabetes are diagnosed. So we are in the process. We are going to encourage our practice participants and anyone that comes in here to have regular reviews. So we are picking up changes in glycemia early on. If we have those we're diagnosed with type 2 diabetes, 80% of it we want to receive, understand good control of your blood pressure, your cholesterol, your diabetes within what you've set up with it. We also want to have good control of the blood pressure as well too. Very important that we look at you as a whole. So we're looking at your blood pressure, your cholesterol, and your blood glucose levels. We also want to ensure that we are looking after your cholesterol, reducing your risk for cardiovascular disease. And those with type 1 diabetes, we want to ensure that you have access to affordable blood glucose self-monitoring, and that is going to include technology and insulin pumps. So within Next Practice, that's really what we are trying to achieve for our clients at every stage of their life, from children right up to the end. And I think that I wanted to really finish off the thing. Today is a launch of a great initiative in Australia, which is going to go worldwide. And it is around how people feel when they have a diagnosis of diabetes. These are just 2 quotes that have come from individuals in Australia. And particularly, I want to highlight the quote there by the person with type 2 diabetes. So this is a lady that received feedback from a healthcare professional, and it was interpreted by the individuals, oh, you've got type 2 diabetes, so it's not real diabetic. It's self-induced. If you just lose some weight, you won't be diabetic anymore. Didn't look at the individual and had very low risks, as you would see onto it. And it really had a big impact on how that person wants to do. If you live with type 1 diabetes, you often get looked at if you have to inject, or you've got a pump, or you've got something stuck on your arm. And people say, why do you need that at the time? Please take time to think about the words you used. A lot of the time, people will feel blamed and shamed when they have a diagnosis of diabetes. And that is where the stigma comes back to it. And it has a huge impact on how the individual feels, their physical health, their emotional well-being, and their quality of life. So my last thing is really think about how it is to have a diagnosis of diabetes if you live with it, but how you talk to the person as well at the same time. So I'd like to open it up if anyone's got any questions, taking your time coming in. And please ask anything, state anything. There's only a brief overview. We'll do more across the next 12 to 18 months on things that you might like to learn about, know about. So yes, thank you.
Great, thanks, Liz. As you say, let's open up for questions. If anyone's got any questions, there's 3 ways you can ask questions. You can unmute yourself, turn your camera on, and just ask questions. We're a relatively small group, so that's absolutely fine to do that. There's a chat functionality, and so you can pop questions in the chat functionality. And there's also a Q&A box to ask questions as well. So whichever way works for you to ask questions, please feel free to do so. Whilst we're waiting, maybe Liz, for some people to think of a question and ask that question, I've got sort of 2 or 3 questions to kick us off. Sometimes people, particularly with type 2 diabetes, think of it as this is it. This is like for forever. But certainly, I think there's more and more sort of evidence saying that we can actually reverse diabetes, can't we?
Yeah, that's correct. It used to be once the person had a diagnosis of pre-diabetes or diabetes, that was it. More and more of our research, and we are translating that research, is actually saying is that you can actually put it into remission. You can actually reverse it. That is through making those changes in your lifestyle. And the other thing, we have to think of the other tools we have. So if a person is having issues with their weight, we do know that the use of bariatric surgery, if it's a big thing, can actually put it into remission. We also know some of our newer medications are really there to support and will also put it into remission. So I think the principles that we have, if you had a diagnosis, is first off, how are we going to put that into remission? How can we get it back down there so that your body is not exposed to large amounts of sugar and is not going to get the complications? So yeah, that's our goal right at the start, is for anyone diagnosed with pre-diabetes or type 2 diabetes, let's put it into remission. Let's get rid of it. If you're living with type 1 diabetes at this point of time, the clinical research is saying that we may be able to use some of the newer types of medications around to prevent or delay the onset of type 1 diabetes, but that's still in the early stages at this point of time.
Okay, so type 1 diabetes, some hope and promises out there.
Yes.
This type 2, we've certainly got good evidence to say we can put this in remission and overcome the diabetes.
Yeah.
That's great. So again, please feel free to raise your hands and ask a question, pop something to the chat or the Q&A. Whilst again we're waiting for that, another question, Liz, which is around prevention. So this is primary prevention. So people haven't got diabetes yet, but they've done a risk score, like what you showed earlier with the link there. And it shows high risk, let's say. What are the sorts of things people can do to help themselves prevent getting diabetes? And maybe you could even perhaps speak to sort of Medicare support that might be around getting those health assessments at that stage.
Yeah. So right at this point of time, if you do your risk assessment and you've identified it, you're moderate to high risk, the first thing is to make an appointment to see your general practitioner. Bring along your risk assessment, have that discussion about where things are going to. At that point of time, it's highly likely that you'll have a suite of pathology done so that it knows where things are covered, so it's onto it. And as a result of that, we may then go ahead and look at developing a chronic disease management plan that allows you to access allied health professionals to help with the developing of your self-management plan to put it into remission. And so that might be a referral to the dietitian to look at your food choices. It might be involvement or a referral to an exercise physiologist to look at ways to increase your physical activity. The research that's been done in the US and the UK has come up with some guidelines that actually say if you look at increasing your steps by 500 steps a day, you'll actually increase your life expectancy by 2 to 4 years. If you increase your moderate amount of activity, so your huff and puff with your exercise, if you increase that up by another 5 to 10 minutes a day, and that equates to about 30 to 45 minutes across the week, you are going to reduce your risk for complications from death from cardiovascular disease by about 10%. If you reduce your waist by 5 centimeters, it reduces your risk for insulin resistance by 500%. If you look at your sleep, if you improve the quality of your sleep, the amount that you're having, the quality of your sleep, and the chronology, so going to sleep earlier rather than later, it has positive benefits on reducing your risk for insulin resistance, so reducing your risk for developing diabetes. If you can stop smoking, huge benefits again on reducing your insulin resistance as well too. So the other part to play into this is your psychological well-being. Again, if you come and identify that you have anxiety or stress, we have the tools to help you refer on to get tools that you can do online at home or talk to somebody. And that's also going to reduce your risk of developing diabetes at this point of time. So the key message here, make that appointment, take that next step, come and see your healthcare professionals, get a self-management plan that you can work with that's going to reduce your risks.
Great, thanks, Liz. And my ears really pricked up when you said 500 steps a day.
Correct.
So, often people feel like they've got to do lots, but actually starting small makes a big difference.
Walking down to up and down in winter, up and down the corridor for 10 minutes after your meal, if it's in summertime, going out to the post office and back, working around, if you've got a backyard, working around that. If you've got a few stairs, doing a few stairs. It's huge what that little bit can actually do.
Yeah. And one of the things, and this is a little bit age dependent, is Medicare does, if you're at high risk of diabetes, provide a rebate for a comprehensive health assessment for people aged 40 to 49. That doesn't mean that's the only time you should be checking.
Correct.
You can do that other times as well. And as you say, Liz, if it's high, go and see your healthcare professional. If it's moderate, go and see your healthcare professional, because the earlier we start with the prevention, the better, really.
Yeah.
Again, I don't think we have any questions on chat or the Q&A. We have one here from Tony. Just give me a second, Tony, and we'll just get your question up. So how can people living with diabetes make the most of glucose monitoring systems, such as CGMs versus using a BGM in the self-management of diabetes? Maybe I might just get you, Liz, to talk to those acronyms so everyone understands what they are.
So they're the two acronyms we do, and you've got to understand as healthcare professionals, we have our own language. So it's really important when you come and see us is that you make sure that you understand what we're saying. So when we're looking at managing and self-management of diabetes, one of the big keys to that is knowing what your blood glucose levels are. There are two ways we have currently to do that. That is through capillary blood glucose. That's the thing you'll hear is prick the blood glucose level and you get an immediate result of what your blood glucose level is at that point of time. These days, we have now access to something called continuous glucose monitoring. And what that does is it allows, through a device that you wear in the subcutaneous tissue, just on your arm or your abdomen, to continually monitor your blood glucose levels over a 24-hour period. So what you are doing is you are seeing what's your blood glucose doing is at any particular time of the day, be it when you wake up first thing in the morning, whether it be after you've had something to eat, whether you have after you've done some exercise. So it is a really positive way of getting feedback immediately to what's going on. The difference between the two of them, one is a point in time. It doesn't allow you to see what happened before or what happened after. If you wanted to do that, you are needing to do blood glucose levels 6 or 7 times a day, prick your fingers. And some people find that very inconvenient, hurts, and they don't want to do it. I say the key to doing all of this is work with your healthcare team. Talk to your healthcare professionals about it. Is it right for me? How can I do it? And importantly, interpreting it, understanding what it actually means about it. We don't just recommend something, send you off just to do it without getting you back, interpreting and making a difference from there.
Liz, can you maybe just give us a sense of, if I was coming to see you as a patient with diabetes, when might you suggest continuous glucose monitoring to me as opposed to doing blood glucose levels?
So it can happen at any time, but one of the ways that I tend to use continuous glucose monitoring in the person, say, with type 2 diabetes, is if we are looking at therapeutic changes. So if the individual comes in, we've got some abnormal blood glucose levels that have some blood that are much higher than normal. So they've come in and they said, I've been doing my food choices, I've doing my exercises, but I'm still not achieving the targets that I want. That is a good opportunity to actually put on the continuous glucose monitoring to see what's happening on a day-to-day basis, to see what the therapies that we've got, whether they're working or not working, and actually design a therapeutic care plan based on what the needs are of the individuals. It is a huge tool for designing that, but also even after 3 or 4 days, the individual can actually self-evaluate. Well, when I have this look what happens, or when I do this look what happens. So maybe if I do it regularly, or if I look at, I've put in place my management plan for manage my anxiety, and when that's improved, look what actually happens. So it can be used at any time, but often it is the best time to look is when we're trying to work out a therapeutic plan for what goes on to. So it's not about throw in another medication, but what else could be happening in the background around to it.
Great, thanks, Liz. So again, if you've got any questions, just a reminder, pop it in the chat, put it in the question and answer, or just take yourself off mute and speak to it. We're a small group, so happy to receive questions. Liz, tell me a bit. So I moved from the UK, as you know, just over 10 years ago, 11 years ago. And certainly at the time I moved, Credentialed Diabetes Educator didn't exist in the UK. So it's a sort of new role that I came across as a migrant to Australia. Tell me a bit more about what is a Credentialed Diabetes Educator? What's their role? How do they fit into the care team?
Okay. So a credentialed diabetes educator is a healthcare professional and I'm going to elaborate on that a bit more, that's completed some postgraduate studies and then has gone on and completed a professional organization, a period of mentoring, period of able to demonstrate advanced clinical practice, and then is recognised by the federal government and Medicare as being credentialed and able to provide services to the individual with diabetes. The healthcare professionals that can become credentialed, become a credentialed diabetes educator, then credentialed, include the exercise physiologists, the registered nurses, the midwives, our dietitians, our pharmacists, the physiotherapist, and just recently the ophthalmologist. So there is a big group of healthcare professionals that actually can become credentialed that are part of your team. So each of us does a different aspect of supporting you around to it. But we are a unique group of professionals. And why I say that unique is that each year to maintain our credentialing, we have to demonstrate that we are working at an advanced clinical practice level, that we have the skills and knowledge and remain up to date to support the individual. So our regency of practice, that means that we know what we're talking about and that we are able to give you the best support that you need at that period of time.
Great. Thanks, Liz, for explaining that. So last chance to ask any questions you may have. So I'm going to ask Liz one more question, but that gives you time to pop in some more questions either into the chat or Q&A. My last question for you, Liz, is if there was one message people take away from this half an hour we've had at lunchtime today on World Diabetes Day, what would that message be?
Diabetes is not the person. The person lives with diabetes. So the person has a condition. Diabetes doesn't define who they are. That person with diabetes can be whoever and whatever. It doesn't stop them from doing anything. But to achieve that, they have a team that helps them get there. So live with diabetes well. Have your team that supports you to do what you want when you want.
Great. Thank you so much, Liz, for sharing your insights, your knowledge, your wisdom. We have taken a recording of this webinar and we'll make that available and share the link with you. So if you want to pass it on to other members of family, friends, please feel free to do so. We'd love to also hear from you. What would you find useful if we were to do more of these webinars in the future? What topics would be of interest to you? What would you find useful? So we will send out a little questionnaire just asking for your feedback, and we'd really appreciate it if you could just give us 2 minutes of your time, particularly with feedback around how you found today, but what sort of things would interest you for the future as well. And with that, thanks again, Liz.
Thank you.
Thank you to all of you for giving up some of your lunchtime today to join us. Enjoy the rest of World Diabetes Day, and we look forward to seeing you next time.